Good evening. Whistleblowers have told the BBC about bullying and discrimination taking place at East Yorkshire's two biggest hospitals. An inspection published yesterday found that the Hull University Teaching Hospitals required improvement overall, and its A&E department was rated inadequate. Two clinical staff members who wished to remain anonymous described it as a toxic place to work. The hospital has apologised and says it's working on changes. Vicky Johnson has the story.
Inadequate for safety and requiring improvement overall, the official verdict on Hull Royal and Castle Hill hospitals. But it's not just inspectors who are concerned. We've heard from staff who say the atmosphere is toxic, workloads are unmanageable, and others admitting they're simply firefighting. One NHS worker who wants to remain anonymous told us,
"The senior management team have become more driven by targets, and this has led to bullying, discrimination, finger-pointing and more. Junior team members have become demoralised and scared to speak up. Experienced doctors and nurses have left in droves."
Those at the top say improvements have been made when it comes to tackling bullying.
You get to a point where people are so tired, so burned out, that if they're being asked to do something they don't feel comfortable with or they just don't want to do, then that will often result in people using terms like bullying. I'm not saying we're perfect, but I don't think it's as big an issue on this occasion as was picked up in the report.
Staff shortages are an acute problem across the NHS, but are particularly felt here.
At the moment, I believe it's still 1 in every 10 jobs across the country are not filled. And there are currently record levels of staff sickness in the NHS, which means that all the staff who are still there are having to pull together and cover so much more work than they would do if the NHS was staffed as it should be according to sort of safe staffing levels.
The problems facing the hospital trust have even been raised in Parliament.
I'm disappointed for my constituents and for the extremely hard-working staff who work in the area, which has huge health and social inequalities. So can we have a debate about how health inequalities have widened over the last 13 years?
When it comes to the care given to patients, the trust was rated as good. And senior managers say some of the other issues raised are already being addressed. Vicky Johnson, BBC Look North, Hull.